Brahanda a croeso. Good afternoon and welcome to Public Health Network Cymru's webinar series. My name is Professor Diane Crone. I'm the Director of the Centre for Health, Activity and Wellbeing Research at Cardiff Metropolitan University and a Non-Executive Director of Public Health Wales. It gives me great pleasure to chair this webinar today. We have two presentations that present the findings from two extremely important areas of work that collectively demonstrate the importance of understanding the complexities that exist in the lives of children and young people and of the factors influencing and affecting them. The webinar aims to demonstrate that to ensure children and young people in Wales have the potential to have good health and well-being, approaches that connect across different parts of the system in which young people live, learn and play are critical. We have two presentations from Nerys Edmonds from the Wales Health Impact Assessment Support Unit and Amy Davies, a Principal Public Health Officer from the Health Improvement Division at Public Health Wales. Nerys will be presenting findings from the Mental Wellbeing Impact Assessment published recently, titled Protecting the Mental Wellbeing of Our Future Generations, Learning from COVID-19 for the Long Term. Amy will be presenting learning from the early rollout of the Welsh Government's framework for embedding a whole school approach to emotional and mental well-being and how the programme has been implemented across Wales to date. This webinar has been developed to enable two connected pieces of work to be shared that highlight the synergies within Public Health Wales to help us build robust evidence and then support the system to turn evidence into action. Importantly, this webinar will highlight how schools, an important part of the system for the promotion and facilitation of good health and well-being, are playing a part in the iterative approach to supporting mental health and well-being of our future generations. But before I introduce our first speaker, a little bit of housekeeping. After the presentations, there will be a chance for you to ask questions, so please do use the chat box at the top of the screen to type in your questions throughout the webinar. The webinar is being recorded and will be made available on the Public Health Network Cymru website after the session. English and Welsh subtitles are available. These can be switched on using the button at the bottom right of your screens. However, we are aware that the Welsh auto-generated subtitles are sometimes inaccurate. If you experience any difficulties with the technology, please let us know through the chat box and the team can contact you directly. So, without further ado, I would like to now ask Nerys to present the first of our two presentations.
Thanks very much, Diane, and thanks for your support for the webinar today. And thanks to Public Health Network Cymru for hosting the event today. We really appreciate your support. So I'm just going to bring my slides up. Maybe if Marie could just let me know that they are showing okay, that would be great.
Yeah, all fine, Nerys.
Thank you. Okay. So what I'm going to cover today is give you a brief introduction to mental wellbeing impact assessment, as it may be a new tool for some of you, give an overview of the aims and objectives of the work that we've undertaken and a guide to the outputs, so that if you want to find out more about the findings, you can find them and know what's available. And I'm going to give a summary of some key findings and actions relevant to educational settings. So mental wellbeing impact assessment is a health impact assessment tool, and it's focused on the factors that promote and protect mental wellbeing. And it's a tool that can be used to assess the impact of any policy or service or setting on the mental wellbeing of different groups of people. It's framed around three core factors that promote and protect mental wellbeing, which are enhancing control, building resilience and community assets, and facilitating participation and inclusion. And it also assesses impacts on the social determinants of mental wellbeing, such as housing and education. And it also aims to assess the impact on different population groups so that we can understand how different groups of people can be impacted by the same policy or service. The overall aim is to maximise positive impacts on mental wellbeing and minimise or prevent any negative impacts. It's underpinned by a much more detailed framework that I'm just showing here. And for each of those protective factors, you can see there's about 10 different components. And within mental wellbeing impact assessment, we consider impacts on both individual mental wellbeing and community wellbeing, and the resources and environments that are available to support people's mental wellbeing. So things look like feeling safe, having access to informal emotional support, activities that help you connect with others, and opportunities to express your beliefs or views. So the aim of the work that we've conducted was to inform current and future policymakers about how the mental well-being of young people has been impacted during the COVID-19 pandemic. The reason we did this was that at the start of the pandemic, I think there was a strong sense that mental well-being would be impacted by the type of measures that were put in place to protect health, such as lockdowns and school closures. But there really was a lack of evidence because the situation was so unprecedented. It was hard to really understand in more detail what those impacts might be and exactly how different measures might affect different groups of people in the population. So we set out to identify both the positive and negative impacts of the pandemic and how they impacted different groups of young people. And it was actually very important to the young people that we spoke to as part of this work that we did consider positive aspects, because they actually felt they wanted to hear and focus on more positive messages as well as the many difficulties that they'd faced. We wanted to understand and enhance their understanding of the factors that protect mental well-being and provide evidence to both inform recovery, but also our future planning for emergencies and pandemics. We took a long-term focus and have tried to highlight what learning can come out of the pandemic that can help us protect young people's mental well-being for the future. We considered young people aged 10 to 24. We looked at all elements of the pandemic, including school closures and lockdowns. So we didn't isolate one particular policy measure. We looked at the whole situation. We started the work scoping and commissioning some of the work in November 2020. The evidence base that we used to identify impacts included three main sources. So we conducted focus groups online with both young people and teachers to get their insight and views as to how the pandemic was impacting them and young people around them. We conducted 2 phases of a literature review, and we also produced a population profile that provides a baseline of young people's mental well-being at the start of the pandemic, so that we can understand what the position was as the pandemic began to affect young people. It will also provide a baseline to go back and look in the future about how that's changed. We gathered this qualitative data from focus groups, and I've just got a couple of quotes up here, as I haven't got enough time to look in detail, but we will be publishing a report with many more of these insights from young people and teachers later in the year. We've published 3 infographics and a summary report, as well as the main findings and a technical report. So if you're interested in finding out more about the methodology, the technical report is probably the place to go. The 3 infographics, the first one covers some key messages that we found about how young people coped. And we actually asked the young people we spoke to what would be their top tips, that they would tell a person in the future, how to cope with lockdown. And these were the messages that they came up with. So you can have a closer look at that afterwards. We've got a summary of key impacts and an overview of the key findings as well in this infographic. So to move on to the key findings, we identified negative impacts across those protective factors. So if you think about that table that I showed you at the beginning, we identified negative impacts across many of those, some of which will have impacted the whole population, such as disrupted social relationships and education and loss of access to group activities. We also found that at the moment, there's really insufficient evidence to really assess in a robust way how many young people have been affected, to what degree, and for how long impacts may last. Much of the stronger evidence is still from earlier in the pandemic, and I think we can all understand, having lived through this process, that the pandemic has been a very dynamic and changing situation, where the experience in 2021 was quite different for that in 2020. So I think the impacts are very much emerging still. We also know that mental wellbeing outcomes fluctuated during the pandemic. So where there are studies that have gathered data on mental wellbeing outcomes, either from pre-pandemic and then during the period or throughout the pandemic, we know that generally there were worse levels of mental wellbeing when restrictions were tighter and schools were closed. However, we also saw that in September 2020, when restrictions eased and schools went back, generally in certainly the Understanding Society study, levels of well-being in young people returned to the sort of baseline level. So it's a complex picture. There is strong evidence of negative impacts on the social determinants of mental well-being, such as education. And we know also that socioeconomic inequalities have been magnified, and that has implications for long-term mental well-being. We also identified different impacts on different population groups, and we hope that this information will be helpful for schools and regional partnership boards as they begin to develop their plans and think about the needs of different people in their population. So the groups in Table 1 are groups that there was strong evidence of a higher negative impact or a disproportionate impact on mental wellbeing outcome measures. And then the groups in this second table, it's a longer list. Many of these groups had pre-existing higher levels of vulnerability to poor mental health before the pandemic. Or some of them may have become more vulnerable during the pandemic, such as young people affected by bereavement or young people with parents who are key workers. These groups, we have some evidence of impact on either outcome measures, but definite evidence around the negative impact on the protective factors such as that resilience and control. Coming on to a summary of the impacts, I'm going to look at this over individual, family and community levels. So at an individual level, for some young people, they develop new coping and thinking strategies that helped them during the pandemic. And a lot of the young people we spoke to gave examples of that. And quite a number of studies talk about more time for hobbies and interests. However, we do also know that there are many negative impacts, such as we've already talked about, negative impacts on emotional and mental well-being. Feeling isolated and missing contact with friends and family was the major factor that young people in Wales said was affecting how they felt during the pandemic. A really changing environment in terms of what it means to feel safe, and a lot of negative impacts on how safe young people felt, not feeling in control. Social skills and confidence affected. So young people spoke to us about that, but teachers and schools also identified this, as well as some studies, and more time on screens and social media and less physical activity. At a family level, we know that having more family time and spending time talking with parents was a protective factor for mental well-being in the pandemic. However, for young people who were living in situations where there was violence, abuse or family conflict, that was a negative impact for them. The environment that young people were living in also had an impact on their mental well-being, such as having space, outdoor space and space to study. Community resources were also important, and opportunities to express views, feeling listened to, and community cohesion were positive and protective of the mental well-being during the pandemic. But loss of access to really important community resources such as parks, youth clubs, leisure centres, less places to safely meet with friends, and disrupted access to trusted adults were all negative impacts. In terms of the school and learning, we know that some young people did develop more independent learning and digital skills. However, there is strong evidence around learning losses and widening inequalities in attainment, and this has implications for mental well-being, as well as, and we know that worries about exams was a really prominent source of anxiety for young people. Whilst there was a positive in the sense of investment in self-help information online during the pandemic, we also know there was actually a drop in confidence in accessing mental health support online, and that there was disrupted access and longer waiting times for mental health support. One of the really strong themes that comes throughout the work that we've done is just the really strong and important role and vital role really of schools and educational settings in promoting mental well-being for all the factors that I've got listed on this slide. and therefore the loss of access to these things during the pandemic was a strong negative factor. We also know that schools and colleges adopted many new approaches to adapt and respond to the need for more emotional support and to try to maintain connection with young people throughout the pandemic. And that there was this increased investment in online information. However, Resting have highlighted that this much of these resources remain unevaluated at the moment, and I think that's a really strong link into the whole school approach and looking at how we engage young people in designing information and tools and evaluating what's being provided. This slide is just highlighting the data that came from the Children's Commissioner's report, highlighting that the proportion of 12 to 18-year-olds who said they would be confident accessing help online actually reduced. And there's other factors that have been highlighted by surveys with young people that act as barriers to accessing support that go beyond provision of information, but also about the kind of beliefs and concerns that young people have about accessing help, such as feeling that they don't deserve help or that they don't want to burden the NHS. And I think there's a really opportunity there to try and overcome some of those barriers with some positive messages. Young people's voice has been a strong theme throughout our work, and how important it is for young people's mental well-being, but also designing appropriate responses in emergencies to meet their needs, that young people are engaged. We've also highlighted these longer term factors that we think could be relevant to the longer term mental well-being of young people that we think need consideration in the future. I've highlighted just the overall areas for action. I don't want to go over my time, so I just want to highlight that we've one of our areas for action is about strengthening action on mental health and wellbeing in education and listening to young people, and we know that that's a really strong area that Amy's going to talk about now. So thank you for listening. If you want to find out more about mental wellbeing impact assessment, we've got a masterclass in October. And I'm now going to hand over to Amy for her piece. I'll just stop sharing. Thank you very much. Thanks.
Hi there, everybody. Thank you so much, Di and Neris. I'm just going to bring up my slides. Perhaps Marie or Kath, would you give me the okay that those are
Yes,
showing?
they're fine, Amy. Thank you.
Great. And you can hear me okay?
Yes.
Oh, brilliant. Thanks, everyone. Well, thank you again, both. I am going to cover now in the next little while just a little bit about what the whole school approach to emotional and mental wellbeing is. I'm going to introduce some of the learning about implementation from Public Health Wales evaluation activity and highlight where I think there are some complementary areas of action linked to the mental wellbeing impact assessment that we've just heard about. So what is a whole school approach? Well, it recognises that every aspect of life of the school can impact on the health and wellbeing of all those within the school community. So students, teachers, support staff. It's really about not just what takes place in that classroom, but in all of the day-to-day activities of the school, the relationships between people and the environment that the learning and activities take place in. And a successful whole school approach involves learners, parents, carers, staff, governors, all working together to improve wellbeing based on a really good understanding of the specific needs of that school. A whole school approach also considers all aspects of need. So from those universal approaches to promoting good health and preventing ill health, to the more targeted approaches for those individuals at a greater risk and specific support for those with identified needs, a focus on early intervention. And a whole school approach delivered successfully will involve effective working partnerships between the school and all of the agencies in that wider system that provide the specialist advice and support. So in March 2021, Welsh Government issued the framework called Embedding a Whole School Approach to Emotional and Mental Wellbeing, and that's statutory guidance to the governing bodies of maintained nursery, primary, secondary, middle, pupil referral units, special schools and local authorities in Wales. And this framework aims to provide a direction to address the emotional and mental wellbeing needs of all children and young people, as well as school staff, as part of a whole school community. And it gives an opportunity to schools to really promote that positive mental wellbeing, prevent mental ill health, and to take that action to support individuals as needed. A whole school approach is a continuous process of reflection and improvement that should enable the school to embed ways of working that protect and promote wellbeing. Self-evaluation tools and guidance are provided, and that is kind of a broad overview and starting point for schools to develop their approach. And it is a process that should be returned to over time as part of a continuous improvement journey within the school. There are 8 implementation coordinators in post working across the 7 health board areas in Wales, and they've been providing absolutely invaluable support to schools in a variety of ways to help them develop their school approaches. And using that available support, we've found has really enabled schools to develop that dialogue across the school community that's helping them to identify what they're currently doing well, what areas need further development or improvement. And over time, it's intended that in doing this self-evaluation, schools will draw on lots of different sources of evidence from hard data, including things like their SHRN data, as well as exploring the thoughts and feelings from the whole school community. And when schools have identified those areas for improvement, they're prioritising these into an action plan that's addressing gaps and building on their strengths. And they're incorporating that into the wider school development and improvement planning cycles. And in turn, they'll be expected to review the effectiveness of measures that they have put in place. Also, just to mention that linked to that cycle, Public Health Wales are also developing a What Works toolkit, which aims to give schools an easily accessible repository of information about the evidence of effectiveness behind some school-based interventions in this area. Really to try and help schools select interventions that are really in line with their individual needs. So these are the areas that the whole school approach covers, and each one has several indicators sitting underneath it. But overall, leadership and commitment is really about the school having that ways of working, policies, allocation of staff and resources, clear leadership and commitment to emotional and mental wellbeing. Understanding and meeting the needs of learners and staff. That's really about that, awareness of emerging issues, understanding and monitoring outcomes within those groups within the school. Involvement and engagement. That's about school demonstration of how the whole community is engaged and involved in that day-to-day life of the school, influencing decision making, reviewing progress. The workforce strand, that's about how the school supports its staff to maintain their own well-being, but also effectively promote emotional and mental well-being of others. There are some specific indicators in that go into a bit more detail about, for those staff that have specific roles in relation to mental well-being, ensuring they've got access to the professional support that they need to do that role. Relationships is about the school recognition of the importance of relationships and school connectedness in underpinning wellbeing. Help and support services touches on the school evidencing how it's proactively recognising signs of problems and working with others to facilitate timely access to help and support. There's a strong link there to the CAMS in Reach programme that many will be aware about. That's complementary activity about strengthening that knowledge, skills and confidence to support young people and get access to timely support. School environment and facilities, as it says, that's about the environment of the school supporting wellbeing, and curriculum is really about where that school's curriculum, teaching and learning strategies are demonstrating a clear understanding of the importance of building the foundations for good emotional and mental wellbeing. So that's a quick run through of what the whole school approach is. I'm sure you can read more about it for those who are really interested. But to capture some of the learning and make sure that we can adapt and change our approach as necessary, Public Health Wales are carrying out a process evaluation that's exploring the implementation of whole school approach. There's also a wider evaluation of the policy implementation, which has been undertaken by Cardiff University. But between January and March 2022, we carried out the first phase of a longer term evaluation exercise that's drawing together learning to describe how the whole school approach has been embedded in Wales. And in this first phase, we spoke in depth with the implementation coordinators, heard from schools across every local authority area in Wales, and undertook a thematic analysis of the data we collected. So here are some quotes from those who engaged in the evaluation. Overall, we found that there were steps in place that had eased the process of implementing the whole school approach and were making it appealing for schools. 95% of the schools we spoke to reported feeling confident that the implementation was beneficial to promoting positive mental health and wellbeing for learners and staff. And we found that schools have experienced positive support and engagement around implementation, both feeling supported with the self-assessment and action planning process, and also successfully engaging groups in their wider school community, getting that commitment from staff. There was some mixed feedback from schools in terms of the timing of implementation. So 43% agreed that the timing took into account other pressures within the sector. So we were able to conclude from the phase one of our evaluation that the whole school approach is highly valued by schools and professional stakeholders. The feedback that we got from implementation coordinators across Wales suggests that delivery of the programme has really contributed to a strengthening of partnerships locally. And schools are really recognising the potential benefits that the approach brings for promoting mental health and wellbeing of their learners and staff. All schools felt supported by their coordinators in that process of self-evaluation and action planning. And there was a high degree of consensus that time and competing demands were the main areas of challenge that they were facing. So we made a number of recommendations after the phase one of our evaluation. It really highlighted that need to further develop and support the clear local governance and strategic accountability, so that oversight and leadership for the whole school approach in every area of Wales. And it highlighted that maintaining that implementation support role and the coordination provided by Public Health Wales were important factors to continuing embedding the approach. We also recommended that easy to use guidance for schools would be a really key enabler in embedding the approach going forward. Coordination approaches and co-production approaches were used when we developed the guidance and the tools initially, and we recommended that be continued and strengthened in work to review that guidance and tools to make sure it's really meeting the school's needs. And there was a strong recommendation really that those resources that support the programme are going to be really important for consistency in approach and scaling up that work to embed the framework across all schools in Wales, whilst allowing for that flexibility that's needed in the local context. We also found that the Welsh network of healthy school schemes practitioners are vitally important to increasing that public health capacity locally that supports schools. And there was some feedback that suggested that their schools were finding it challenging to embed engagement across the wider school communities, particularly with parents, all staff groups within the school, governors. And we felt there might be a benefit to exploring some further co-production work to build capability in this area and really support that promotion of the whole school approach ethos as a way of working. And flagging as well that it's important that any tools that are produced that support that engagement with the wider school community, such as learners or parents, that they're really co-produced and tested with those groups. So The second phase of the process evaluation intends to produce a series of case studies, and they'll be available throughout the rest of this year and 2023. And the aim of these is to describe, explain, and explore that continuous improvement process of adopting the framework on embedding a whole school approach to emotional and mental wellbeing. And by case study, we're talking about using an interpretation of different types of data gathered from a wide range of sources to identify some specific learning. So it's a really detailed investigation in that real life context. And in this evaluation, we really want it to draw out knowledge on what is working and why, for who, and in what circumstances. And we want those case studies to be able to facilitate the transfer of knowledge and evidence to enable effective practice. So our first case study is exploring how and why schools have engaged with the self-evaluation process, investigating how the guidance and tools have been used and the extent to which the whole school community has been involved in that process. And we've spoken with members of the senior leadership team in 3 different secondary schools across Wales and collected responses to a survey from schools with secondary age learners. And we've analysed some documents that have been provided to schools and provided to us by schools that are supporting that self-evaluation process. So we're still finalising the first case study. However, I can share some of the key emerging findings, and I'm sure that we'll be sharing links through the network when the case study itself is published, for anyone who is interested to read that when it's available. But there is an overwhelming sense that self-evaluation as a structured process is helping schools to really understand their unique needs and strengths in relation to promoting and protecting the mental wellbeing of learners and staff. There is some variation in how involved different groups within school communities have been in that process of self-evaluation and in the methods used to engage the different groups within the school community. School senior leadership teams and learners are those who appear to be the most heavily involved in embedding the approach. And also these are the groups which are viewed as the most important to success alongside school teaching staff. And we're also finding that schools are utilising a wide range of data sources to enable that robust self-evaluation. And they're also employing different techniques to reach consensus on the areas to prioritise in their action planning, especially where there are diverse views from across different groups within the school community. And we're also finding that where schools are discovering for themselves where that whole school approach to emotional and mental wellbeing complements other programs and policies that they're embedding, like embedding the new curriculum, ALN reform, SRE reform, and where they are using complementary activity, it's reducing the burden on staff who have a dedicated wellbeing role within the school. So finally, I just wanted to touch on the places where the areas of action that NERIS identified in the mental wellbeing impact assessment interface with those aims of embedding a whole school approach to emotional and mental wellbeing across Wales. I think a really important area is learner voice, and that's a key part of the whole school approach in conducting the self-evaluation itself, and also in creating those opportunities for learners to inform that continuous improvement in the school. I think another area is where the whole school approach aims to help schools proactively recognise the signs of emotional and mental wellbeing problems and work with others to facilitate that improved access to timely help and support. But also, it ultimately aims to strengthen action on mental health and wellbeing in the education system, whereby schools are being encouraged to embed these new ways of working that aim to promote and improve the mental wellbeing of their learners, staff, and the wider community across their whole school environment. And I think that very much speaks to some of the action points that NERIS has identified. So, diolch, thank you for listening. I'll pass back to Di now. who I believe is going to facilitate some questions and answers and wrap us up.
Okay. Thanks ever so much, Amy. Thanks both of you, both to Neris and Amy, for those. Both presentations were fascinating and thought provoking, and really for me they illustrate the importance of a joined up approach, both within a school, but also with agencies, as you've mentioned, and as well, Neris, with your work in that wider system as well. And it's so important to have that joined up approach where parts of the system not only talk to each other, but work iteratively together to support the mental health of our future generations. And so very important, as we come out of the pandemic. So now we've got some time for some questions. So I would encourage you, if you have any questions, to please put them in the chat. We've got a couple of questions to kind of kick us off that hopefully will get our audience thinking about their own questions. So I'll ask a question for you, Neris, first, if I may. I mean, somebody did put in the chat about the population profile data and where that was available, and there was an explanation of where that could be found. But I'm just wondering what's the sort of next steps, Neris? Are the plans to do that population profile again to see what change has occurred, and also what are the next steps for the how we roll out the findings and the recommendations from your work?
Thanks, Diane. Great question. It's actually the second time someone's asked me that today, so it's a really great to hear that question, actually, because I think we would really like to be able to take forward the recommendations. And I think at the moment we're kind of concentrating on disseminating the findings, but I think we will be starting a conversation about, how do we take forward and monitor the implementation of the areas of action. Obviously, we all have a link to the baseline population profile that we constructed for the mental wellbeing impact assessment, and I think Hugh is online, who supported me with that work. We also identified a set of indicators that are linked then to the impacts. So within mental wellbeing impact assessment, once you've identified a set of impacts, you can then decide how could we measure these, how can we measure these ongoing to see, A, do these impacts occur, and B, do they improve, do they get worse? So we have actually proposed in the technical document as well as a set of indicators that could be used using actually a lot of our existing data within the national indicators, within the Schools Health Research Network survey, that go beyond, it's great to have a measure of mental well-being such as the Warwick Edinburgh scale that we have that monitors essentially an outcome measure of mental well-being, but actually we kind of need to go beyond that really and look at the range of factors that have been impacted. So within the indicators, we've actually proposed a set of data that we can use to monitor the ongoing impact. And I think what would be good is to really start a conversation about how do we take that forward? How do we use that actively to monitor? We have got a kind of track record of doing that with we did a health impact assessment of Brexit, and that's exactly what we did there. We did a review, I can't remember, it's about a year later actually, to look back and say, what's happened with those impacts? Did they occur? What's happened with the recommendations? So I think there will be an intention to do that. I think at the moment we're concentrating on getting the findings and discussing what we found. But I think, I'm really glad that you've raised that, and I hope that we do get that opportunity. Thank you.
I think for me, you highlight a really important aspect as well, that, the use of measures, one measure only measures one thing. Yeah. And this, if we're taking a systems approach, we need to understand all of the factors in the system, and it's not possible to measure everything, of course, but at least be aware of the different factors that are there. And I think, your work clearly has done that. Well, we still don't have any other questions, so I'm going to go back to my list, Amy. So, Amy, I've got two questions for you, actually. You've talked about, well, actually, it might be a question for both of you. You talked about the inclusion of young people's voice. And I think, I'm sure many people who are listening today sort of, we always want to include young people, but it's actually quite difficult to engage. And so I just wondered whether, for both, perhaps a question for both of you, how challenging did you find it engaging with young people? And can you give any sort of tips and hints for people who might want to do something similar with that sort of co-production angle? So Amy first, and then Neris.
Yeah, no problem. I mean, the whole school approach guidance and the framework itself really talks in quite a lot of detail about that importance of bringing the voices and experience of the school community in its wider sense. And I suppose it's not a new approach. I think the schools and education sectors have been working with this kind of ethos for a long time. But there is a challenge, I think, in that translating of some of the technicality of those indicators. So, within each of those areas that I spoke about, there are several quite more specific indicators. And particularly for some of those larger schools, all schools actually, translating that in a way that learners can really understand and give an informed view on their experience and opinions as part of the life of that school isn't an easy task. I think there've been a lot of great support from the implementation coordinators, giving that kind of that very kind of direct hints, tips, support, ideas. They'd created some questionnaire tools that were helping schools to engage different groups, including learners or parents. And other schools have tried very different approaches, bringing together small groups of young people to talk through some of the areas of the whole school approach. In a more of a workshop style, putting on different activities, councils, kind of student wellbeing committees and groups. I think we've seen lots of different ways that schools are bringing in learner voice that's appropriate to their school communities. I think it's interesting that out of all of the groups that we've been looking at in this case study, it's SLT and learners that are coming out as the most involved and the most important. And I think it's kind of parents that are a more challenging group that schools are finding harder to engage. So I think it's really positive that the guidance and framework itself puts that learner voice so much at the heart of what embedding a whole school approach is. And I think over time, it'll be very interesting to draw out some of that particular learning about what sorts of approaches have worked for different types of schools. So hopefully some of that will come out in our case study. Thank you.
Neris, do you want to give us a quick answer? Because we've got some questions coming in now. So if you give a quick answer to that, and then we can go to the audience questions.
Sure. Just to say, so for the mental wellbeing impact assessment, we really wanted to hear the voice of young people because we just felt they know how the pandemic's affecting them, and I felt that the work really needed to hear from them. Bear in mind that we were conducting this work during the second lockdown in early 2021, and within mental wellbeing impact assessment, some of my colleagues in other parts of the country and the world had started doing online focus groups, and that's not something we'd done before with mental wellbeing impact assessment. So I got sort of some learning from them, and we then worked very closely with some youth engagement agencies, including Young Wales and Leaders Unlocked, to really help us because they already had young people they were engaging. That's kind of what their specialty. So we worked basically with the specialists to help us reach 3 groups of young people in Wales, and we worked with them to design, kind of to adapt our methods to that with their advice. And I have to say it was absolutely fantastic doing the online sessions. That young people were very engaged, very clear about their views, gave us some really rich insights. It was probably the highlight of my working life last year was talking to the young people. It was so I really, sometimes, yes, there are challenges to overcome, particularly when we were working remotely during the lockdown. But I have to say it was so important that we overcame those challenges to speak directly to young people. So I just really encourage people prioritise this. It's really important.
Yeah, I couldn't agree with you more. Neris, I'm going to stay with you because we've got a question for you. Then Amy, I'm going to come over to you because we've got a couple of questions for you. So Neris, we've had a question that, hi Neris, you mentioned that the impact of COVID is still emerging. Any evidence or research around how long the impacts will take to tail off? Are we talking a couple of years or decades, or is it unknown? Is there any modelling that's been done? Not sure whether you'll be able to answer that, but have a go.
I think overall the answer is it's unknown. There was a particular study that drew on some previous work. So there are a couple of people who've drawn on kind of work from previous pandemics or and there was a previous study looking at the long-term impacts of loneliness on young people's mental health. But I think one of the challenges with that type of evidence is that some of it's extrapolated from very different scenarios and context. So I think, to be honest, it is unknown at the moment. And I think it's something we need better longitudinal data to be monitoring more closely.
Sorry, I'm muted. And I've just got one more for you, Neris, and then I'll come to Amy because Amy, I've got a couple for you, so I'm trying to keep them, grouping them, and I think we'll have time to cover them all. So Neris, it's from Charlotte Gray. Did you try and engage with young people who are digitally excluded, hard to reach, and would this be important to your findings?
I think the young people we engaged in the focus groups were quite a diverse group of young people. So they, included young carers, young people with mental health issues, both young people who are working, those in college, or school. But given the scenario we were in, it was, I would say it was a convenient sample, and they were all young people who were engaged already in kind of youth participation. So absolutely, it would be great if we could have reached beyond that. And yeah, ultimately that wasn't possible, but we have tried to draw on other work that engaged young people and got qualitative data in other ways as well. So there was a study by the Scottish Government that looked at the wellbeing impacts of the pandemic on young people, a number of groups that they identified as more at risk, including young people. So there were a number of other sources we used. We didn't just rely on our focus groups for the views of young people.
Okay, thank you. Hope that answers your question, Charlotte. So I'm going to turn to you, Amy. I've picked up. We've got 4 questions in the chat that have come through. So I'll ask you them in the order that they've come through.
Okay.
So the question is, they're interested in the What Works toolkit. Is the scope to include tools, resources that are already available to support with aspects of the framework, such as play, and then also someone added, and the outdoor environment?
Yes, in short. So the toolkit itself, we tested an approach to generating the content for this over the kind of summer and autumn last year. We tested it with 6 interventions. There is a stakeholder group around this whole school approach work, I should have mentioned, and they're very closely involved in, doing that steering and of the direction of travel. So we drew on that stakeholder group to understand which interventions we knew were being used across a number of schools in Wales as our place to start. And it's a 3-phased approach. So we kind of gather information about a particular intervention or approach. There's a formal evidence review, which is looking very clearly at the evidence of effectiveness of that approach delivered in a school as a universal preventative intervention, outcomes for learners or the staff groups. And then there's a process of reaching consensus on a final statement around evidence of effectiveness with an expert panel. So like I say, we tested that approach with 6 interventions that are known to be in use in schools in Wales, and those will be the first round of things that are made available on the toolkit as that gets made, put in the public domain and made available to schools. So yes, we are in the process of starting the next round of reviewing around new and different interventions, and we've been talking to stakeholders about whether there's scope over time to build up. So there will be things that are readily available and in use in school settings that we'll be looking at. There's a conversation to be had with stakeholders about whether we stick to kind of individual interventions or programs in that traditional sense, or whether we've got some scope to look at approaches, so nature-based approaches, arts-based approaches, for example, or whether it's more sensible to break that down into more specific, smaller elements that build up into a story of evidence around those types of approaches over time. So yes, it will be things that are in place in schools already, and we're keen to work with stakeholders on suggestions and ideas for what we could prioritise. So yeah, do get in touch, anybody that wants to have a further input into that. I hope that answers.
Yeah, thank you, Amy. Yeah, and I think there's been added to the chat someone interested in getting involved further in the FE aspect as well moving forward. So that's directly linked to what you just finished off with saying, to get involved. Another question for you. I think you might have you talked about this, but the question is, are there any initial plans for how to engage parents in the whole school approach?
Yeah, I think schools again are trying different approaches to that based on their different relationships they have with parent groups already. I mean, I think it's traditionally quite a challenging area for schools. It's certainly something that we hear. And the lots of different ways, they've tried kind of surveys, meetings online, in person, putting on events. So there's lots of different things that we are hearing that schools are trying. And I don't think that the challenge of engaging parents in this is particularly unique to this approach or this issue. I think it's a general challenge that education settings face.
Yeah, sure. Well, at least you're trying, and then that's the main thing, isn't it? You have to try different strategies. Okay, I've got 2 more questions for you, Amy. I think time will allow for that. How far would you say we are confidently able to support the delivery of a whole schools approach within Welsh medium education settings? That's from Nia Evans.
So yeah, the whole school approach is being rolled out across every setting. The support that is available in terms of documentation, it is all bilingual support tools. I'm not sure that I have kind of enough of an insight or information to speak to the other types of wider support that might be available specifically through the Welsh language. I think some of what we're looking at in the toolkit work, where we're looking at particular interventions, some of the important things we consider in that are whether the so for many of these interventions, they're delivered by school staff who are trained up to deliver that programme. So we look at whether that training they can receive can happen through the medium of Welsh, and whether the resources provided by the intervention itself to learners or to the wider staff groups are also available in Welsh. So that's an important consideration in building up the evidence base around interventions. And the implementation coordinator and Welsh Network of Healthy School support staff, work all the time normally through the medium of Welsh with Welsh medium schools to provide support on this and broader work through Healthy Schools. So I think that there are a lot of mechanisms in place. It's definitely something that we are as part of our considerations when we're looking at this. So I think we can be, there's a degree of confidence there. I hope that answers Nia's question.
I'm sure Nia can follow up, obviously individually with you as well if she wants to take to do that. And just very lastly, if I can ask for a quick response to this, Amy, because I do want to then conclude the session so that we keep to time. So questions come in. Could you see the whole school approach working for physical activity too? There's a piece of work coming out of Healthy Weight, Healthy Wales and the National Physical Activity Group to increase the amount of physical activity, which in turn can obviously have a positive effect on mental health and well-being. That's from Sue Williams. So quick response.
Yes, I think a whole school approach as a way of working, it doesn't really matter what the topic is. I think that can work. You know, it's an approach and a way of working within a wider school community. So, yes.
Okay, that was a quick response. Okay, thank you very much both again, and unfortunately that's all we have time for today, but many thanks to both Neris and Amy for their great presentations and your responses to the questions, and of course to the team of people who have worked with you to produce these excellent presentations and reports. So thank you. Today, just a little bit of information for you as we conclude. So today is the first in a series of Public Health Network Cymru events this autumn, representing the work of teams across Public Health Wales on the theme of mental wellbeing. So please do look out for further events coming up in October and November, and I think some of those have already been identified in the presentations. Work is also starting on a policy briefing on public health approaches to improving mental wellbeing, which many of you I'm sure will be interested in. So lastly, we'd be grateful if everyone joining the webinar could complete a short evaluation. A link will be put, I think a link has been put into the chat bar already and also will be sent to you. We also hope you'll join the Public Health Network Cymru if you're not already a member. And again, a link was put in the chat earlier on for that as well. So finally, if you have any thoughts on future webinar topics, please do let the team know at Public Health Network Cymru. And diolch yn fawr, thank you very much for joining us today. Thank you.